Now let's look at a few sample cases. The first is an 86-year-old male patient who presents with microscopic hematuria, non-nephrotic proteinuria, and a rising serum creatinine. Since in this case he has microscopic hematuria, we'll start by looking at phase contrast here with the 40x objective to look for the presence of dysmorphic red blood cells or acanthocytes. Indeed, here we see a number of acanthocytes floating by, which tells us that this is likely glomerular hematuria. Also note in contrast, the normal red blood cells under phase contrast appear bright white and round, symmetrical, compared to the acanthocytes, which appear very dark here. Here on a different slide, with Sternheimer-Malbin staining under the 10x objective, we start by setting up Kohler illumination, first by focusing on the subject, then closing the field diaphragm, adjusting the condenser focus until the outline of the field diaphragm is in good focus, and then opening the field diaphragm until the light fills the field of view. Scanning around, we see a cast here. We're going to go up to a higher power here with the 40x objective. And focusing up and down, we can tell that there are cells within this cast. They look like red blood cells, but we can't quite tell what else might be there. So we'll go up to the 100x oil objective, looking a little closer. Focusing up and down, we see red blood cells. These are very fresh red blood cells without much sign of degeneration. Focusing up and down, we see a couple other cells, a white blood cell at the top with a segmented nucleus and a tubular cell with a large eccentric nucleus. Here we'll switch back to an unstained slide under phase contrast with the 10x objective, scanning around. We come upon a pigmented cast. We can't quite tell whether it's a granular cast or a cellular cast. On the 40x objective under bright field, here we can see that this is cellular. We can make out the outline of what appear to be red blood cells. Under phase contrast here, we were better able to see the outline of the red blood cells both within the cast and also see some acanthocytes in the background. This cast appears to be degenerating. We can see the outline of the red cells, but within the interior of the cast it looks more like pigmented granular material. Here on the 100x oil objective we get a much better view. We'll see an echinocyte or crenated red blood cell floating by there. Focusing up and down, you can clearly make out the outline of red blood cells on the periphery of this cast. And again, it looks like the interior of the cast is more of a pigmented granular material from breakdown. So this cast is in the process of degenerating into a hemoglobin cast or a pigmented granular cast. We see a few acanthocytes floating by, some tubular epithelial cells adherent to the outside of the cast. And here on the right side, we'll see some preserved red blood cells. In this case, the ultimate diagnosis was microscopic polyangiitis. This next case is a young girl with a history of IV drug abuse, bacterial endocarditis, acute kidney injury, and hematuria. Her sediment had red blood cell casts, mixed cellular casts, but also the unexpected finding of trichomonas, seen here. You can also see identified a couple glitter cells and a tubular epithelial cell. Here in another image, we see a very good example of a mixed cellular cast with tubular epithelial cells, white blood cells, and a red blood cell in addition to two trichomonads. The presence of white blood cells, tubular cells, and red cells suggests that this is an inflammatory or proliferative GN with tubular injury. Here, a diagnosis of necrotizing crescentic GN. Here in this next case, we have a 45-year-old female with diffuse pulmonary infiltrates, hematuria, proteinuria, and a rapidly rising creatinine. This looks like a cast under low power phase contrast. We're going to go in for a higher power view with the 40x objective. First setting up Kohler illumination. We'll center the image of the field diaphragm and open it to fill the field of view. We'll adjust the lighting. We see what looks like a red blood cell cast, but it looks like there may be some other cellular elements here. We'll focus up and down a little bit, and then we're going to change to phase contrast. This is Still with the 40x objective, you can clearly see the outline of the red blood cells. You can also see clearly some dysmorphic red blood cells in the background. Now we're under dark field. We can adjust the lighting a little bit, get a better image. You can see the outline of the red blood cells in the cast. You'll also notice in the background, as we focus up and down, we can focus on the red blood cells in the background and very clearly see the outline. You can differentiate dysmorphic red blood cells and acanthocytes using dark field microscopy when you don't have phase contrast available. Here under the 100x oil objective, again, we're going to verify Kohler illumination, center the image of the field diaphragm, and focus up and down to get a better idea what those other cells are. Clearly there's a white blood cell there, another one there. Continuing to focus up and down, it looks like there's a few other white blood cells you can see clearly right here. We're now going to switch to a Sternheimer-Malbin stain slide. Here under the 100x oil objective, we see a mixed cellular cast. This looks like predominantly red blood cells, but there are other cells there. We're first going to verify Kohler illumination, center the focused image of the field diaphragm, and then open up the field diaphragm to fill the field of view. Then focusing up and down, we can clearly see these look like white blood cells based on a segmented nucleus. Now scanning in a different area of the same slide, we come across several red blood cell casts, some hyaline casts, and some scattered cells. Focusing up and down, we can see what's within the interior of this cast. Here we have another red blood cell cast. They're packed so tightly you can hardly see the protein matrix surrounding the red blood cells. Here it looks like a cell with a large eccentric nucleus, perhaps a tubular cell. There's a white blood cell labeled. We'll scan upwards a little bit more. Here we see another red blood cell cast. Focusing through this, we see the presence of a white blood cell right in the middle of this cast. You can see the segmented nucleus well here. Here on another area of the same slide, we come across a broad cast. It looks like it has a waxy character to it, but also contains a number of cells. We'll also notice several white blood cells. If you look closely, you can see the granular motility. These are glitter cells. The pale blue staining ones are very viable, the darker staining ones less so. Then as we look closer within the cast, focusing up and down, we can see that these are mostly red blood cells. But there's one structure on the right that looks like a red blood cell, but it's a little different color, it's a little larger. Can't quite tell what this is. So we'll insert the polarizer and the analyzer and see if this gives us a clue. Now we can see what looks like a very clear Maltese cross pattern. When we rotate the polarizer, it's clear this is a lipid droplet. So what initially looked like it might have been a red blood cell under polarized light is lipid. The diagnosis in this case turned out to be anti-GBM disease. This next slide is a good example of degenerating red blood cells. Here under 100x oil objective, you can see the presence of Heinz bodies, which are clumps of denatured hemoglobin along the red blood cell membranes. Here magnified an additional 150%. This next slide shows the presence of a number of round structures within this cast, which turn out to be lipid droplets, which we see clearly with the addition of the polarizer or an analyzer. As we rotate the polarizer, you can see these very clear Maltese crosses. We'll focus up and down to see all of the different lipid droplets polarize. As we rotate the polarizer, you get a nice rotating Maltese cross here. Here is an example of a mixed cellular cast seen under phase contrast. We're going to go in for a closer look under the 100x oil objective. This is an unstained specimen. As we focus up and down, you can see the different cell types. Now focusing up and down in a different section, we can clearly see these large eccentric nuclei, which are tubular epithelial cells, and the segmented nuclei, which are white blood cells, and then the red cells, which have a very smooth homogeneous cytoplasm. In our last example, we'll see another mixed cellular cast here under phase contrast. With the 40x objective here, we'll need to get a little better resolution, so we're going to go to the oil objective. Focusing up and down, we note a number of different cell types here. The large eccentric nucleus shows us the tubular epithelial cells. The droplets appear to be lipids, and there are also red blood cells. That's the end of our sample cases, and now we will go back to review the next steps and some useful resources.